Good afternoon, everyone. This is Amanda Pierce-Kelly, the National Advocacy Director at NAC. It is 2 o'clock on the nose. We're going to go ahead and get started here. Welcome to our national kickoff webinar to get things started with National Health Center Week 2016. We are so thrilled to have all of you attending and listening in with us today, and to be joined by two incredible speakers from a couple of different health centers in Virginia and Georgia. The advocacy team together puts on this webinar with our wonderful friends from health centers around the country each year as a way to really kickstart all of our effort and our work to have a wonderful National Health Center Week. So we're thrilled this year to begin that effort. Just a couple of housekeeping things to get us started here. If you have questions at all during the webinar, you can use the chat box. The slide that you should be seeing in front of you right now lays out how to do that. There are so many of us on the line right now that it's hard to keep an open line. We don't want to have any issues with feedback, but we do really want to be responsive to your questions. So if at any time throughout the webinar, whether it's a technical question, you're experiencing some kind of issue with the webinar itself, or in terms of the content, questions for our speakers or how to access resources, please don't be shy. Type your question right in the chat box there, and we will take them as they come in if it's important, or certainly at the end there if there's time. So I really want to get started here just by saying thank you. I can't say it enough to all of our national sponsors. They really enable us to have the size and success of celebrations that we do every year. Everyone that you see on the slide in front of you, every level is really important to getting us over that finish line and helping to make Health Center Week even bigger than the year previous. We're really, really thrilled and so appreciative to have the support of all of our national sponsors this year. So a big, big kudos to them. And really looking forward to being able to connect them with many of you. One of the things that we're able to do is in partnership with our national sponsors is to connect them to local events so that they can sponsor those as well. And we'll talk a little bit more about that later, but again, just a big warm thanks to all of our national sponsors, and looking forward to getting them plugged in on the ground with many of you directly. So here we go. So really quickly here, the theme for National Health Center Week this year is Celebrating America's Health Centers, Innovators in Community Health. For those of you that may have been with us during the Policy and Issues Forum, the theme of innovations is one that we have been carrying throughout the year, and I think will carry well beyond National Health Center Week, but we're really thrilled this year to be able to showcase a lot of the innovative things that health centers are doing around the country. When we talk about innovations, it doesn't necessarily have to be something earth-shattering. I think innovations, health centers represent innovations in and of itself. It's a program that was created out of innovation, and it continues to innovate each and every day by meeting the true needs of our communities. And so when you think about how you're going to frame and build your events this year, we encourage you to think about that theme and build around that innovations concept, and think about how you at your health center really are thinking about and caring for the true needs of your community. The date this year, hopefully many of you are already very well aware, but the dates this year for National Health Center Week, always falling again in that second week of August, is August 7th to the 13th. And again, the theme, Celebrating America's Health Centers, Innovators in Community Health. So just some tips here, which I'm not going to jump into too much because I want to make sure we have time for our speakers. Sorry, let me back up here. But just some really key factors to get you all started and get the juices flowing around National Health Center Week. 5 tips to success. Get started early, and that's what we're here to do today. But the more time that you give yourself to think through what kind of events you want to put on and be creative and thinking through your invitation list and your possible list of sponsors, the earlier you get started, the better. Being successful in National Health Center Week and really with any event requires a team so that you have the appropriate planning and support and the benchmarks to keep you on track throughout the way. So just encourage you to think about who are the team of people that are going to help you to be successful this year. Outreach, making sure that you're connecting with folks and getting invitations out to the folks at the local, state, and federal level in terms of your elected officials, talking to and reaching out to sponsors or potential sponsors as early as possible and asking them to help you get the word out. And of course, the media. The more heads up that you can give your TV, your radio, newspaper, and online outlets, the better. They're often, believe it or not, looking for a positive event to be able to cover, and National Health Center Week is a great opportunity to do just that. Persistence is another one which we use a lot when we talk about advocacy, and it certainly is in keeping when it comes to National Health Center Week. Whether it be creating a timeline to continue reaching out to your elected officials and the media, making sure you're staying in touch with your invitees, the point is to stay on top of it, be persistent. Until you're given a firm no for an answer, just keep following up. Make sure that your communications plan includes regular updates for sponsors, attendees, and the public. And again, that's just to keep everybody aware of and on board with all the great things that you'll be having going on at your health center during National Health Center Week. And the last one, more or less a golden rule for life, and certainly with advocacy and National Health Center Week, is just to say thanks to those that have helped you along the way, who will help you to put on a positive event, and to let them know how things went after you wrap up. So after you've hosted that fantastic, successful event, you want to be sure to let them know how things went, invite them to participate the next year, and again, give them a little bit of praise for helping you to be so successful. So with that, let's jump into hearing from our wonderful speakers. We're going to get started here with Amanda Palmore. She's the Director of Marketing and Government Affairs for Central Virginia Health Services. She's a graduate of the Advocacy Leadership Program, and she's also an MVP Advocacy Award recipient. Amanda began working for CVHS as a student worker in 2000 and rejoined full-time in 2008. One of her first tasks upon arriving at CVHS was to help re-energize the organization for Health Center Week. And now, fast forward so many years later, she is still an incredible success. Over the years, CVHS has had 100% site participation in Health Center Week. And in addition, Amanda tends to be our go-to person on the ground in her neck of the woods in Virginia for all things Health Center Week and of course, for advocacy as well. So with that, I'm going to turn it over to Amanda to share some slides with you and get started with her presentation. So, Elizabeth, perfect. Amanda, are you there?
Yep, I'm here.
Great.
Awesome. Let's see. All right. Well, thanks, Amanda, and hello to everyone. Amanda had asked me to take a couple of minutes to talk to you guys about one of their Health Center Week activities that has been kind of outside of the box from the usual health fair and back-to-school event and has really been really successful for us. So just to give you guys a little bit of background information about Central Virginia Health Services, we're very different geographically. We have 17 sites. They're both urban and rural, and we've kind of redefined Central Virginia. We go from, you know, almost the D.C. area, close to Fredericksburg, to the North Carolina border. So we've really kind of redefined Central Virginia, and Health Week for us is like Health Center Month because we're just on the go all the time. So to tell you guys about the event that's been really successful, several years ago, a provider at our Charlotte Primary Care site, which is a very southern county in the state, got the idea from NPR to do an intergenerational project. She enlisted the help from staff children and from the providers, and the providers identified patients that were around 80 years old and up on the secret to longevity. The staff children spent time with the seniors, learning about them and their lives, and that provider's husband also happened to be a photographer and was able to kind of document through photos the visit that the child had with the patient. So during Health Center Week, we had a program, and the kids all had their seniors there, and they shared with the audience what they had learned. And at that time, we also unveiled the pictures that were taken during the visit. And they were really just awesome pictures. They really captured the spirit of the person. And we had those pictures printed and blown up on canvas and hung in the waiting room with a quick blurb about their secret to longevity. So the Intergenerational Project was probably one of the best events we had. It was really heartwarming to see the relationship between, you know, a younger person and an older person. And just from an advocacy standpoint, we happened to have one of our more difficult legislators there, and we really kind of knocked the socks off of him. He hadn't been to one of our health center sites before and kind of had a preconceived notion of what we were all about. But when he was there at the event, he really got to see firsthand the impact and how invested the staff and the patients were in the community health center. So we're going to fast forward to the next year. Something really amazing happened, and everyone wanted to do another project similar to that. So this time, not only did we have the staff kids express interest, we actually had kids from outside of the community. This event also coincided with the site's 40th anniversary, and patients who had been, so they decided to really talk to patients who had been with the practice since it began 40 years ago. So during that program, we actually had the first provider in the practice, which, as a side note, his son is now a provider in that practice, and the office manager, which is, she's been with us for 40 years. And everyone had talked about how the practice had changed, had really, you know, gone from paying your doctor's bill with, you know, your garden harvest and the provider making house calls to, you know, how it is today with the electronic health records and, you know, how far it had come. And the kids were really amazed at how things were 40 years ago, and we really had the, you know, the same good, heartwarming time as we had the previous year. And that same legislator who had been there the previous year, when we saw him in Richmond, he said, "Hey, are you guys having another event? I'm not going to miss this one for anything." And he actually, you know, put a resolution into the General Assembly recognizing the health center for their contributions in the community. And so we kind of have that relationship with him, which has been really awesome. So let me see the slides. So here are just a couple of pictures from the event. We actually had, were lucky one year to get a sponsorship from McKesson, and you can see the picture on the right is actually one of the McKesson representatives dancing with one of the ladies who was interviewed for the Intergenerational Project. And here are just some more pictures of some of their patients and kids that participated in the event. We really just, you know, had a really good time. Some of the seniors wanted to showcase some of the talents that they had. The gentleman on the right, you know, played the electric guitar back in the day. And it was really just a good time. And here you can see these are displayed in our waiting room. These are the pictures that were blown up with just little tidbits of advice. And that's really been one of the neat things. All of our patients comment, you know, how great it is to come in and see, you know, just words of wisdom from patients displayed throughout the health center. And not to go over too much more of what Amanda had gone over, just some overall tips for Health Center Week. We really start planning in March and gearing up, letting the sites know that Health Center Week is coming up. It's on every meeting agenda, so they know that they need to start planning. Plan early. It not only helps with advertising, but it helps with their elected officials and our donors. And what we've had really good success with is asking local businesses for donations. And a lot of times we do that ask with specific stuff. And folks are a lot more likely to donate, you know, cases of water or fruit or anything you need before they will money. And really don't get discouraged. We've had events where literally no one has showed up, and you really just have to find what works for your community. We've got one health center that had previously not had anyone show up to their events, and they found that a yard sale and a health fair worked really well for them. And now it's a cornerstone event for that community. They have over 300 people that attend. The community looks forward to it every year, and it's even grown to the point that they can charge now for spots, and all of that money goes towards the pharmacy fund for our neediest patients. So really, you know, just don't get discouraged and just keep at it. And once you figure out what works well for your community, the rest of it is going to be a breeze.
Thank you so much, Amanda. Any final thoughts? And again, if you've got questions to those in the audience, just go ahead and type them right in that chat box, and we'll either take them up as we're going along here, or we'll make sure we leave a few minutes at the end to take questions. But anything else from you, Amanda?
No, that's it.
All right, thank you so much. You know, part of what I love about what you guys do, and you in particular, Amanda, you know, we were just talking about innovations. Well, I think this event is a really great example of an innovative way to celebrate National Health Center Week, and something really innovative that the Health Center has chosen to do. I think you stated it perfectly, that finding what works for your health center, for your community, for your, you know, staff and board is really the key to being successful at National Health Center Week. As far as we are concerned at NAC, and I know at primary care associations across every state in the country, the size and the scope of the National Health Center Week event or celebration really does not define success. Some health centers are in a great position and have, you know, dollars available to support large events, or they have been at it for a number of years, and so they put on massive events and they're hugely successful in their community. But I tell you what, I know a lot of health centers around the country that really do much smaller events, even something as small and simple. One of the best examples I like to use is a health center out in California that, you know, they had never done anything for National Health Center Week before. They didn't have a big budget, but they chose to buy a big banner recognizing National Health Center Week. They spoke with their city council, and they were able to hang it in their on their main street in their small town. And it made all the difference in the world. It was really wonderful exposure for the health center. It came with a lot of visibility around the services and all of the things that they brought to the community. Of course, you know, nobody necessarily knew about National Health Center Week, and here was this beautiful banner that hung downtown Main Street for the duration of the week. And it was a really wonderful way for them to celebrate National Health Center Week in their community, and it didn't come at a large cost, but it was a really simple, special way for them to celebrate and be recognized. So I would just encourage folks, if this is your first time thinking about how you can participate in National Health Center Week, don't be overwhelmed or discouraged. As Amanda said, there's always a way to get involved, whether it's, you know, opening an hour early and doing a little, you know, community open house with some coffee and an opportunity to meet and greet health center staff and providers, hanging something like a banner on Main Street, all the way right out to, you know, a massive back-to-school fair, health fair, where you have thousands of people show up. So we're here to help whatever form your events take, and I'm just really proud of everybody who has done such a great job at celebrating National Health Center Week in years past, and for all the good stuff that's to come. So I think for now, let's switch gears and move on to our next speaker. We'll turn the controls over to Margarita Bledsoe. She is the Director of Marketing and Outreach for the Family Health Centers of Georgia in Atlanta. This woman is a total Health Center Week guru. She is somebody that I went to many, many times last year, and I'm just going to ask Elizabeth for help getting the controls turned over here to Margarita. And moving the slides so we can make sure her slides are up. Margarita has 31 years of experience in everything from project management and grant management to sales and marketing and PR, event management, professional training, staff training. She is just a wonderful, wonderful resource to us on the ground at her health center for National Health Center Week and really for a number of things. One of the things that I was most impressed with in working with her, especially this past year, is that she has such a diverse program of events throughout the week. This is a woman who is an absolute expert in terms of getting started early, putting a great plan together, executing it beautifully, bringing in all kinds of different stakeholders, and I'm just thrilled for her to be able to share her wealth of experience and success with us today. So Margarita, I'll turn it over to you.
Thank you so much, Amanda. The first thing I need to do is to let everyone know that I have 31 years of experience because I started when I was 2. I really don't want you to calculate from college forward. I was 2 years old, and that's where my resume starts. I really want to thank Amanda, and I want to thank Elizabeth and Dorian and the entire NAC team for asking me to participate in this opportunity. And I also want to thank the Family Health Centers of Georgia team. It is really the team that I work with, the marketing and outreach team, that allows me to be able to make this presentation. Amanda asked me to talk about engaging elected officials and sponsors, and also to talk about creating engagement through events. So what I'd like to do is spend the first few minutes of my presentation just talking a little bit about elected officials, talking a little bit about the nature of sponsors, events that we've done and how we created engagement. And then at the end, I'd like to try to pull that all together with some tips that I hope would not only help you for National Health Centers Week, but help you for developing and maintaining relationships throughout the year. I love this year's theme. I think that we are innovators in the community health center world. We innovate in that we are forever creating new ways to reach our populations because they are forever changing. And when I first came to the Family Health Centers, we were West End Medical Centers at the time, and our CEO at the time told me that, asked me if I was going to be able to create a marketing plan on a shoestring budget. And I told her later that it would have been nice if my shoes had shoestrings. She gave me a budget with shoes with no shoestrings, but we worked out some things that hopefully have been a success. So I think that all of you on the phone that represent a sales and marketing and outreach effort for your community health center absolutely know how to innovate. So let's talk for a moment about understanding our elected officials. What I really want to point out is that elected officials are people who are appointed by someone or elected by the public. So either they were directly elected by you or they were appointed by someone that you elected. They have a goal of collaborating with other elected and or appointed officials. They are looking for projects and programs and looking at how to fund those things in their district. They should be listening and addressing the concerns of the people that they represent. And they should be looking for ways to obtain testimony from the people that they represent on how their actions are going to impact them. So when we talk about engaging elected officials, it's very important for us to understand that their goal is to serve the people. And the community health centers across this country have access to those people on a daily basis. So they need us as much as we need them. And some of the common traits that you will find with most elected officials is that most of them like to be involved, they like being seen, they like being heard, they like getting credit, they like being recognized with awards and plaques. They want people to talk about them, which is not something that most of us want done, but they actually want that to happen. And especially when you're talking about good work that they're doing. And in some cases, we find those who feel that all press is good press. So there's a need from the elected officials to connect with the community health center and what we're all about, just as much as there's a need for us to connect with them. And then I want to give you a little insight of what I've learned about working with corporations. I was blessed that I came from major corporation work before I joined the Family Health Centers team. And I was on the other end of being a person that was looking for opportunities to give in the community, and I've also been on the end of soliciting for sponsors. So I just wanted to point out some things that I think are common to most sponsors. Most sponsors are looking to have a local presence. So when you start looking at who can I call upon to be a sponsor for what I'm doing, start in your finance department. Go to your CFO, go to your finance department and ask for a complete list of vendors. What are the services that those vendors provide? How long have you been doing business with them? And about how much money you give them on an annual basis, because those vendors need the opportunity to give back to the people that are helping to pay their bills. There are other businesses and corporations and organizations, even nonprofit organizations, that have a presence in your community, and they're looking for a way to be involved. When you think about aligning with their mission, vision, or goals, don't necessarily assume that because you're providing health care, you cannot find a connection to their goals. Toyota is one of our sponsors. Toyota makes cars. A lot of what they do center around safety, and it also centers around the environment. We were able to also tag in on Toyota's concern for the youth in the community. And I'm very proud that this year Toyota is our sponsor for our Back to School event that we will be hosting during National Health Centers Week. And that, again, was approaching them from their position of aligning with their goal of seeing the youth in the community have better opportunities. Sponsors are looking for ways to brand their products and services. I think we have the best example of sponsor branding in the information that NAC has put out. Everything from the previous slide, where our sponsors were thanked for their national support, from the insert that McKinsey did and the posters that was mailed out, in addition to the separate letter that came from NAC that had all of the sponsors listed that came from Dan Hawkins, and then also the sponsors on the posters. So there's so many different ways. If you also get an email from Amanda, you're going to see the National Health Center Week sponsors listed at the bottom of that. So you can give them branding opportunities without it costing you money, because you're already going to be printing posters and printing invitations and things that promote your product and services that you are promoting for National Health Centers Week. And most sponsors are also looking for an opportunity to increase revenue. Our sponsors, we have people that are doing business with our doctors, our pharmacists, our labs, we have referrals, and then don't forget that every year your community health center is paying a great deal of money for water services, for light services, trash services. They're paying money for janitorial services if it's not in-house. So that vendor list is going to be very important for you in terms of how to develop relationships with those people to start obtaining money. You can also use sponsors as leverage to get in the door. Most of you may have the same experience that we have here, that on any given day we can walk through our health center and we find where people have left coupons and left promotional materials throughout the center. Our staff is consistently reminded that they are to pick up that material and give it to someone in marketing. And we contact those people and tell them that your material is going to go in the trash. However, if you would like to partner with us and be a sponsor for the programs that we do and help us then we can help you to reach our patients who's your targeted audience for the product or service that you're trying to promote. And I like what Amanda said, and I agree. Be direct with what it is that you're looking for them to do. We revised our sponsorship forms to tell you how many bottles of water we need for back to school, how many face painters we need, how many jumping balloons and things of that nature. So you want to make sure that you're expressing the one that you need $1, $2, $3 in order to accomplish ABC. If a sponsor can't give you 1,000 bottles of water, it is a very direct ask that they're able to tell you that they can give you 500 or they can give you 200. But if you say anything will help, anything will help does not allow them to set a goal that matches what you really need done for your event to be a success. And then document your giving. Document to them the way they helped with volunteers, because volunteers equal money that you save. Document the hours that the volunteers worked and document the values per hour. And one of the ways that you can help sponsors to brand is encourage them to wear their corporate T-shirts when they volunteer. GE, UPS have served as major volunteers for us, and they wear their T-shirts. So when we go out into the community together to promote Community Health Center Week, it is a win-win. People are seeing GE at work, but they're also seeing GE's partnership with a community health center, and we have people that are more familiar with the GE brand as a household name than they are the family health centers, and so they're more likely to take the information and talk to the representatives. You can use your UDS report. There's information on there about the number of patients that you see, the number of patient visits, the economic impact that you have can be developed from your UDS report, and that is all good information for you to tell the sponsors just how much of an impact they're having. And now I want to talk a little bit about creating engagement through events. When you're creating your events, look for them to be different. I'll share just a couple of things that we do a little differently with some of our events. Some of you may do these things, but hopefully I can also give some help you to start thinking about it. Our Back to School event is held the last Saturday before the Atlanta Public Schools start. We are in do or die. Our patients have waited to the last minute. We're going to get people to come to this event. It has grown from 300, 500, 700 to 1,000 people that come to the event. We also do voter registration drives and other things that attract the adults that are at the event. We've had the mobile bookmobile to come out and set up and give kids books for reading throughout the school year. We've done a radio remote where we've had elected officials to either stop by or call in to the radio station. And again, these people like to be heard, so it is free airtime for them. When you're looking at doing something like a media brunch, you can put that together by using your advertising representatives as leverage. The advertising representatives for the newspaper, radio, television are knocking at your doors. Don't just tell them you don't have any money. Get to know them, because getting to know them can lead you to a visit to their station, can lead to your story being told, can lead to you developing a relationship with the news team. We do an appreciation event for our community outreach partners, and we focus on outreach. And the reason being is that we're not trying at this event, we're not trying to hit the head of the organization. We're hitting the people that are in the streets with us, the people that we see that are helping us to go to the grocery stores, go to the mall, helping us at all of the health fairs and events. The other people that we see for the CMOs, this is their day. And we do it on a Friday. Dorian was there. Thank you, Dorian, for being there. What happens at our community appreciation event stays at our community appreciation event. We dance, we laugh, we have a good time. It's not an opportunity that they have to work. They can leave work at 3 o'clock and say they're going to continue. They can leave their office at 3, and we're continuing to work because we're going to hang out with the Family Health Centers of Georgia, and we let them know how much we appreciate them. Now, you can do something for your community partners and your legislative people with a roundtable discussion, and you can involve everybody. Corporations, other nonprofit organizations in your city have legislative representatives. Ask them to send those people to meet and talk to the other legislators that you're going to have there. A legislative breakfast, because most legislators will eat. And what we really look for, the tactic that we use is to involve the legislators that support you and use them as the host committee. They're not going to do any work to get the people there. and they're not going to do any of your logistical work. But it looks really good when people see an invitation that includes the mayor's name, your city council member's name, county commissioner's name, your state representative's name. And I'm going to talk in a few minutes about how to get those things done. And then sponsor existing events, that it is less expensive for you to sponsor something that is already happening than for you to create from scratch. And you can sponsor at low cost or no cost because your sponsor could be in kind. Your sponsorship could be blood pressure checks, or it could be that we're going to bring someone to do ACA outreach and enrollment, and that will get your name on those people's flyers as a sponsor. Meet and ask the doctor. You have physicians there. All you need is 15 minutes of their time. It could be during lunch, it could be at the beginning of the day, as a coffee break, or it could be at the end of the day. And what you really want them to do is just take a few minutes where they're willing to answer questions that people have. And people love it because they see it as a free office visit. The doctors are smart enough to not give hallway medicine, and they're smart enough to help you to convert that person into one of your patients. And now I want to just close with this, that is, you may say this is easier said than done, and I would say not really. My advice to you, I wanted to give you 25 things that I thought that anyone at any community health center could do, and I'm just going to highlight a few. Involve your state association. They love when you use their logo. Their staff is available to assist you. They are consistently putting out email and social media blasts. Get on board with them. They may have a newsletter, and if they do, ask them how to contribute to the newsletter. They are marketing outreach people just like you, always looking for something to publish. Also, you can gain permission to use your sponsors' names, your sponsors, and your legislative names and images. We created a form, and anytime we do an interaction with a legislator, or we do an interaction with another sponsor, we get them to sign the form that gives us permission to use their name and image, and we don't have to keep going back to them for every event. When you're creating your press release to talk about National Health Centers Week, get in touch with your legislators and ask for a quote. Remember what I said. They like to be heard. They like to be seen. So you can actually get their love it. We are going to be talking about XYZ and how many people we serve. We like to include a quote from state representative so-and-so and so-and-so. Someone in their office will work with you to make that happen. Serve as their direct contact. Give them your cell number. When they want to refer a patient to the Family Health Centers of Georgia, I get a call from the mayor's office, and they will let me know they're sending a patient over. And trust me, our entire team do everything that we need to do to try to make sure that patient gets through our system seamless. But we become their right hand. And I also want you to keep records of your interactions. Maintain it either through a project file or through an automated system such as Salesforce.com, but keep record of what you're doing to actually interact with them. And then just a couple of more. I love the story about the banner going up in the city. Another opportunity that you can do with that is number 19, which is where you create co-op advertising opportunities. We cannot afford an ad in the Atlanta Journal-Constitution. It is extremely expensive. But West End Medical Centers, as we were known at the time, Southside Medical Center and Oakhurst Medical Center, we all got together and we did a full-page color ad in the Atlanta Journal-Constitution Sunday edition. You can do it when you develop co-op opportunities to work with other people. And to close with just two more, know the staff. Know the staff of your legislators. Involve their staff. You can get support letters many times through the legislative staff that you didn't even have to talk to that legislative person directly because they trust you, they know you, and they develop a relationship with you. Involve their family when you can. A wonderful opportunity to serve as the First Lady of a city in Georgia. And during that time, many of the invitations that came to the mayor's office, people would also call my home and extend their invitation to me. It was more likely to get on the calendar because I was in agreement with going. And it was more likely for me to be excited because I had received a personal invitation. So reach out to also do things that include spouses and partners as appropriate. Many times they can also serve as your representative for the occasion or serve as the person that speaks on behalf of the governor or speak on behalf of the mayor. And you can also involve families with volunteer opportunities. When GE and UPS comes out and volunteer with us for our back-to-school event and many of our other events, we encourage them to bring their children so that their children have the opportunity to experience volunteering and know what it feels like. So engagement is constant communication. It's increasing your network for opportunities that when people have an interaction with you, they should feel that their lives are enhanced in some way, that this phone call was of value to me, that when I call that community health center and I speak with that person, I'm going to get an answer or I'm going to be led to an answer. You should be their resource. Engagement is partnerships, it's collaboration, it's coming together for a common goal, and in our case, it's to provide quality health care for the medically underserved in our communities. And I'm going to share a little story with you that there was a pastor, and he was working with business members of his congregation. And the members of the congregation, they were complaining about having to walk up this broken ramp to get to the 4th floor, which is where all of their community activities was being held. So the pastor had a meeting, and he said, come on, you all, let's collaborate, let's talk, let's network, let's see what we can do to make a difference. And they came up with, Pastor, we can build some steps. And everyone thought, oh, my God, that is so wonderful. That would be great. We would love to have stamps as opposed to these ramps. Someone else stood up and said, no, Pastor. Why stop at steps? We can install escalators. And everyone said, escalators, oh, yes, that would be great. Escalators, then you can choose to walk or you can choose to ride. And then someone stood up and said, an escalator, I think we should go for it. Let's install an elevator. And the pastor said, now, that's great thinking. That's leadership. We're going to install an elevator. And I tell you what, I need $10,000 from each of you so that we can get the project started. And they said, Pastor, what was wrong with the ramp? So I want to thank you all so much for listening. Please feel free to contact me. I am available, would love to be a resource for you, and certainly welcome you anytime you're in the Atlanta area to come see the Family Health Centers of Georgia and see what we're doing to make a difference. Thank you.
Thank you so much, Margarita. I love your ending there. Always nice to add in a little bit of humor, but it is true. It takes a lot of hard work. And you guys really have done an incredibly wonderful job of making Health Center Week a success at Family Health Centers of Georgia. And we will certainly come back to you because the work is not done and we're looking forward to another great year of success. So we're going to switch gears now and just go through the resources and some supports that we have put together at NAC to hopefully assist all of you in putting together great events at your health centers and celebrating around the country. It's a very good segue coming out of Margarita's discussion there. The first thing I want to start with is just opportunities for sponsorship, and I think she did a great job of outlining some of the things I'd like to remind people about, which is that sponsorship really does come in all shapes and sizes. I think oftentimes, understandably, health centers tend to think of sponsorships in the most traditional form, which tends to be in the form of cash. And often that's because there are so few dollars associated with health centers that don't have strings and expectations attached. And so sometimes sponsorship dollars still have strings and expectations, but not in the same way that we're used to, and so it's very helpful to have a little bit more flexibility. And there are lots of opportunities for cash sponsorship, so there is that, but there are many other ways to leverage support in the form of sponsorship. In-kind sponsorship, whether it's working with your, is there a restaurant that you go to frequently for catering, for example, for health center events, or if you're recognizing your staff, or whatever the case may be. If you've got a relationship, or even just a restaurant that the staff at the health center frequents, when they are taking their own lunch, going to them and asking if they might be willing to provide some free catering for an event that you're putting on, or talking with your local grocer about, is there any, fresh produce or water, things like that, where it may not be cash, but it can be a very, very helpful addition to your event, and certainly a type of sponsorship that we want to look for. Participation in volunteers, I couldn't agree with what Margarita said more, that having boots on the ground is really such a wonderful resource. It's a really excellent way to build your relationship with those sponsors. They feel very good about it oftentimes, and so, maybe it's a community service event at the health center. It could be you're, doing something outside to tighten up and clean up the space where the health center is located, or it's something inside. You want to put fresh paint on the walls. But the point is, there are lots of people out there that are in a position to sponsor you in the form of participation in person and by volunteering. And so just encourage you guys to think about that and think outside the box when you're considering different types of support and sponsorships. In terms of securing sponsors, we are really, really fortunate at NAC, as I said, to have wonderful national sponsors for National Health Center Week. But one of the other things that we're privileged to do is to pair some of our national sponsors with local events so that they can actually support you with local sponsorship on the ground level. The best way for us to be able to do that is by looking at the event posts on the National Health Center Week website, and I know Elizabeth is going to walk through how to do that specifically. But if you're thinking about hosting an event this year, if you're planning to do that, please make sure to post your events on the National Health Center Week website, because that is the very first place that I go when I'm looking for opportunities to pair our national sponsors with wonderful local events. I can't guarantee, I wish that I could provide a sponsorship, a national sponsorship for each and every one of you. We do our best to do as many as possible each year. And to those of you that we've had an opportunity to work with in the past, Amanda and Margarita both being a recipient of those, it's a really wonderful way for us to tie such great national sponsors to the local events and to the local health centers. Some other things to think about. Just a really simple way to capture potential sponsors is to come up with and survey your contacts. Who do you know? Who do your board members know in the community? Certainly thinking about all of those different types of sponsorships. Are there connections with business partners and that type of thing? The other thing to think through is, who does the health center work with? And I think Margarita spoke to that. You have so many vendors that are constantly working with the health center, and that's very important business for them. And so you shouldn't be shy about creating that list and approaching them to ask for their support. If they say no, that's okay. That isn't failure. That's just their situation, or they may not be in a position to support you in any particular way. But it's still worth having the conversation and letting them know about the work that you're doing and the events that you're planning to host and the ways in which you're planning to celebrate Health Center Week. And some of them may surprise you. Again, if they are not in a position to provide you with cash sponsorship, they may very well be in a position to provide you with in-kind sponsorship or volunteers. So again, thinking through who you're working with is an important element to that. And the last one there is partners. Partnerships are the list of partners that health centers work with is so long and so inspiring, truthfully. And so thinking through all of those various partners that you work with, if you're planning to do a health fair, for example, who are the various partners that might like to work with you on that event? If you're planning to do a back to school or a chronic health event, for example, screening event, are there vendors or partners that you work with that may have an interest in supporting you in some way? So really coming up with those solid lists and surveying your contacts in all their various forms will be a very helpful tool in trying to determine who might be willing to work with you and want to work with you on sponsorship. The other last piece, and I think you heard it actually both from Margarita and Amanda, is that you take what you can get. It's always helpful to have a goal in mind, to kind of budget out your event or a target. But at the end of the day, support is support, and being appreciative and grateful for whatever type of support someone or partner or company is willing to provide is really the name of the game on this. And of course, thinking outside the box, I think that's a huge part of what we do for National Health Center Week, whether we're talking about sponsorship or something else. The other piece that I want to spend a couple minutes on is just National Health Center Week and working with our members of Congress. Just as a reminder to folks, we do host National Health Center Week the second week in August each and every year, and that's because the entire month of August is a congressional recess. And so it really increases the likelihood that you'll have commitment and presence with a member of Congress. And part of what we want to do, one of our big national goals during National Health Center Week, is to make sure that we're educating our members of Congress about all of the incredible work that health centers do, showcasing the success stories, talking about those innovations, and really letting them see with their own eyes the great work that each of you do on a day-to-day basis. In terms of working with your members of Congress and securing that confirmation for them to attend staff, as I said before, you do want to start early and be persistent. The other thing is to be working with and in contact with both staff in D.C. and in the district. It's always helpful to connect the dots to make sure that all of your contacts in congressional offices are on the same page in terms of invitations as they've been issued. I think flexibility is a key to success in working with your members of Congress, and what I mean by that is sometimes it's not possible, but when you're in a position to say to your member of Congress and their scheduler, you know, we really want to have a visit with such and such member, is there a day that they're going to be in the community in the month of August, you know, during National Health Center Week or otherwise? We'd really love to host them. In fact, we're planning on such and such an event, and we'd be happy to structure it around the congressman's schedule. Again, sometimes that kind of flexibility isn't an option, but as much as possible, if you're able to structure your plans around their schedule in order to get them there, or at least to say, here are all the things going on throughout the week. We welcome the Congresswoman to be there at any of these events. You let us know, you know, which day, which time, which event might work best. This is an election year, which is wonderful because they will all be looking for opportunities to be out and about in the community and across their district and state. But it is very important to make sure to pay attention to the timing of your events and the rules around how we engage with members of Congress and with candidates. Just a reminder to folks, and I don't think this will be a surprise, but campaign-type events are strictly prohibited at health centers. It's absolutely okay to have candidates come to your events, but they should be viewed really as educational opportunities. And so issuing an invitation to them along with all of your members of Congress is completely in bounds. But just be cautious and thoughtful about when and how you're engaging them. If you have any questions on that, you can always be in touch with me or with my team. You can email us at grassroots@nac.com for more information. We have some great resources on the Campaign for America's Health Center's website to support you in that. The last piece is that going back to the event posting, we do look for events and track very in detail events where there are going to be members of Congress present. So make sure that as you're posting your event information, you let us know if you've had an invitation out to your member of Congress, and then of course give us an update once you've had confirmation that they'll be attending. Just tying this back to sponsorship, there are occasions where there's an increased likelihood of event sponsorship when there is going to be a member of Congress present. It's not mutually exclusive, meaning there's not, you know, any particular formula that says if you have a member of Congress there, then you'll definitely get a sponsorship or you won't. But it is a factor that we pay attention to. And so again, letting us know that you have invited and then confirmed a visit with a member of Congress during National Health Center Week is a really key element to that. And the last piece that I'll just say is that as Health Center Week has grown, of course, the specific week of observance, as I said, this year is the 7th to the 13th. As it's grown, it's really turned into National Health Center Month. And so any event being held during National Health Center Week or really in the month of August, we would consider a National Health Center Week event. So don't feel hindered or restricted by those specific dates. If you have something that's going on in the very beginning of August or something that stretches to the end of the month, you know, don't be shy about that. We still consider it a celebration for National Health Center Week, and we want to be able to recognize you. So with that, I'm going to turn it over to Elizabeth. I know she's got some great information to share with you, starting with how to post your events on the National Health Center Week website.
Thanks, Amanda. So as Amanda said, there are a lot of benefits to posting your event on the map and the event listing. And you can access that fairly easily at healthcenterweek.com, and there's an events tab right there at the top. And for those of you who've been doing this for a couple of years now, you will notice that there is no password this year. You do not need to wait for me to get back to you with the password in order to post your events. You can go right on, and you can see sort of the template on the left side there, the basic information about your health center, the event, you know, who's coordinating so that we can contact you if we need to, and, you know, other folks from the community or elected officials that you have invited. And the one thing I will say is that if you're getting started early, which you definitely should be, and that's awesome if you've already got some events in mind, just go on and post as much detail as you have. There is a way for you to go back in and edit the events once you have already sort of put the preliminary details in. If you have any questions, it's sort of a box at the top of the screen that you'll see once you re-access the page. If you have any questions, feel free to reach out. There is sort of a help section on that page if you get stuck. But it's pretty simple this year, just sort of posting, putting in a little CAPTCHA field, and then you're good to go. And we will post and approve your events within 24 to 48 hours. So if you don't see them immediately, check back in a day or two, and they should be up there for you. The other thing that we're doing again this year are the picture and video contests, and that is one of my favorite parts of Health Center Week. So start thinking now about pictures and video that best represent your health center and the work that you do and how you'll be celebrating this year. We'll be having a separate, as I said, picture and video contest again. So you can submit one picture and one video per person, but your health center can have multiple submitters. So if you've got some great folks on staff that are taking those pictures and videos, anybody can participate. The rules are up, but the submission form is not live yet. We'll be opening that in August. And because there are so many details and I want to talk about the prizes more in depth and some of the specifics, we'll be having a separate webinar this year just for the contest. So save the date. That is happening on Wednesday, July 20th at 3 o'clock in the afternoon. Just find out what's more in-depth information about the timeline, some of the guidelines for entering the contest, as well as some tips for winning pictures and winning videos, how to get your submissions to the top with the most votes. And stay tuned for information on how to register for that. We will be sending out a link in our Health Center Week communications pretty shortly. So with that, I will turn it over to Dorian to talk about social media.
I'm going to be quick. I just wanted to go over some of the social media promotion for National Health Center Week. Many of you, and you kind of see here on the right, have already gotten started, but the official hashtag is NHCW16, and we also want to encourage you to use the hashtag CHCs Innovate. So if you're doing any innovative work, be sure to use that tag so we can track that, but definitely use National Health Center Week 16 if you're going to be, if it's anything Health Center Week, be sure to do it, because last year we really made a huge splash, and we'd like to do the same thing again this year on social media. So if you look at the photo to your right, it's a screenshot. This is when, as we do every year, asking elected officials to participate, coming, whether they're coming to your health center, coming to your events during that week or throughout the month. But also, once you go in and put in your information with our new platform, you can find your legislator, and then you can send them a message, which will be pre-texted there. And then after that, it allows you the opportunity to, you can see the top, the Twitter icon and the Facebook icon, to share those, share what you've done, or share that you've asked them to participate in National Health Center Week on your own personal Facebook page or Twitter page, but it will also allow them to do the same. So you can send them this message, and then they can say, hey, I'm participating in National Health Center Week 16 in Georgia, and then, it'll also show up on their Twitter feed as well. So please remember to keep that conversation going. We definitely want their participation in that regard. And then on the right, I just wanted to shout out a couple of folks who have already been using the hashtag, so you can see that. And we can jump to the next screen to go over a couple of other things. So if you look here, you'll see we have a set of social media images. Many of you have probably seen them. If you've gone onto the Campaign for America's Health Centers Facebook page, that's our one of them is our cover photo right now. But if you visit the Health Center Week website and go to social media tools, you can download all of these images, and as you can see, they're available in both English and Spanish. And so we encourage you to, use that as your cover photo on Facebook, or a background image on Twitter, or just simply share it out. And then to the right, sorry, it's a little bit awkward of a screenshot, but you can see that if you go to our page on National Health Center Week to social media tools, if you simply just press that, there's a Twitter icon there, a tweet will automatically populate. And so if you're logged in, then all you have to do is press the button and you can let everybody know that you are, in fact, celebrating National Health Center Week 16. So once again, I have faith that it's going to be even bigger than last year, but if you have any questions, please feel free to contact me. And also, please be sure to visit healthcenterweek.com for the latest tools and resources regarding social media.
Great, thanks, Dorian. Just to let folks know and put this in context, the presence of National Health Center Week on social media has just absolutely grown exponentially. And to give some sense of that, in 2014, our reach and our exposure using that National Health Center Week hashtag NHCW16 was somewhere around 7 to 11 million impressions, which means the number of people that we were reaching using social media. In 2015, we were over 48 million. That's because we've seen such an increase in presence of National Health Center Week on social media and folks using that hashtag, which really benefits the Health Center program as a whole. It helps raise the visibility of National Health Center Week. So just encourage you guys, for those of you that are using social media, both personally and in terms of your work at the Health Center, definitely take advantage of it. It's such a wonderful, free, easy way to gain exposure for your health center around National Health Center Week and otherwise. So I'm really happy to be able to, and I'm trying to advance the slide, announce a brand new challenge that we are launching today. And I know we're on time here, so I want to try to make this quick. We are really excited to announce the 100,000 Advocates in 100 Days Challenge. This is something that we're launching officially today. It is in an effort to build our advocacy network. We have done such an incredible thing over the last 10 or so years in growing the program. We're more than 1,300 health center grantees. We're over 9,000 delivery sites. We're serving more than 24 million patients. All of that growth has really been in large part because of the incredible work of our health center advocates, folks just like you that are participating today. Well, to keep pace with that growth in the program, we really want to launch this renewed challenge to build our health center advocacy network. We're about 80,000 strong now, and we want to set a goal. We have set a goal of 100,000 advocates in that network in the next 100 days. Now, the reason that we're kicking this off today is because we think National Health Center Week is a really wonderful opportunity to host some of those recruiting events. But frankly, the effort begins now. And so health center advocates like you, health centers at large, our primary care associations, our health center controlled networks, and partners all over the country are being asked to really ramp up their efforts on advocate recruiting and help us reach that goal of 100,000 health center advocates in 100 days. I'm going to have Elizabeth and Dorian walk you guys through some of the resources that we've created to support folks in this effort. We'll try to get through it quickly, and I know we've got a couple questions, so hopefully we won't take up too much more time, but we're really excited about this and thrilled to be able to make the announcement today. So Elizabeth, do you want to walk through some of the supporting resources?
Sure, thank you. So a couple of things that we have posted on our website in order to help you get started and help us reach that goal of 100,000. We have an advocacy flyer that you can hand out to folks that explains who we are, what we do, and why it's really crucial that they get involved. We have an advocate sign-up sheet that you can print out and take with you and have at community events, passed out at meetings and such. And we also have an Excel template available for easy uploading. If it's easier for you to collect information in a spreadsheet and send it back to us, we can upload it automatically into our system so you don't really have to worry about typing people's names and figuring out handwriting and all of that. And we also have some social media tools that Dorian is going to go into. But for any other resources that you may need that you don't see listed on the website, feel free to get in touch with us and we will help you get what you need.
Okay, Elizabeth, are you ready?
Yep, go for it.
Okay, sorry about that. So yes, we are very excited about 100K in 100 days, and so I wanted to share a couple of graphics and special promotions. These are all available on saveourchcs.org. The link will be shared out, but and it's also listed there. But if you are interested in sharing some of these graphics on social media. They're all available for you, and we really want to encourage you to let your friends know and other Health Center supporters, if they're not registered as an advocate, to please do so and really spread the word. And of course, using our new platform, when you do sign up, you can easily share that you have done so. And then also, I wanted to let you guys know, if you look in the bottom left, you can see we have something a little bit new and to anything that we've ever done with the Campaign for America's Health Centers. But if you are interested and you've signed up and you want to share that out, you can also add a profile badge. So it will be on your Facebook profile. It's called a Twibbon. And so it's all, like I said, it's all on the website. But if you click on that after you've signed up, and you can sign up through that as well, it will automatically populate like a banner that can go over your profile picture, an overlay almost. And then that's just another way of showing your support and getting other people involved. Moving on quickly, like I said, the Twibbon, again, I wanted you guys to see a better view. You can see that if you click there on that website, you can automatically sign up and it can be added. And then at the bottom, you'll see that's the screenshot of the sign-up page, which I'm happy to share out the embed code if anybody would like to have that on their websites or Facebook and Twitter pages and things like that. But that's where you're going to direct people to sign up. So we'd like to see kind of the new following with this particular campaign. So I don't want to take up too much more of the time, but I guess I'll pass it back over to Amanda to close out.
Thanks, guys. And just a reminder, you are able to access all of these resources, both in terms of the specific forms, flyers, sort of hard copy options for doing these recruiting efforts at your health center. Also, all of the social media resources that Dorian has just walked through. We're really excited about all of the opportunities provided as a part of our new advocacy network and platform to be able to do a lot of this work electronically, whether it's forwarding sort of tell a friend emails and links so that people can do it very seamlessly and easily. They can sign up. So just really encourage you to think about how you can host an event to help us reach this goal in the next 100 days. Talk with your friends, your family, your colleagues. If we break this down, what does this actually mean from health center to health center to get us to this goal of 100,000? We're talking 15 new advocates per health center. That's really not very many. I know we can blow this goal out of the water, and we're counting on you guys to help us get there. So I'm going to stop there, and here's just a reminder on how to post your events. Elizabeth, do we have some questions? I want to be fair and take those. I know we're over time, so if folks have to jump off, we can certainly do that. But just questions really quickly?
Sure, we do. We had a question specifically to Amanda, but I think both of our guests can speak to it. Who have you involved in the planning? Is it management, or have you included support staff as well? And then a second question, have you found any notable differences between urban and rural community health centers in terms of planning events and such?
Yeah, so those are really good questions, and I think it's different from health center to health center, and I do want to give both Margarita and Amanda an opportunity to respond. I think, it's a decision in terms of which staff to engage that has to be made health center to health center. I think the more people that you have sitting at the table to support you, the better, as long as there's one person that's sort of designated and appointed as sort of a lead so that that's clear. But I actually encourage a health center week committee, and so you have folks that you can help to delegate tasks out and share different perspectives and, get the creative juices flowing. I just think the more people you have sitting around that table, the better. Margarita or Amanda, do you guys have anything to add to that?
This is Margarita. I would concur. We do a project lead for all of our projects, and it involves everyone from intake to the clinical staff that wants to be involved. And on the question regarding urban and rural settings, we are an urban center. We are inundated with people having all types of events on a daily basis. And so we have to be very creative to make healthcare something exciting and sexy and appealing that people want to come and do. So we use radio personalities, we use TV personalities, we use mascots, just anything that we can to make people more interested in what we're doing as opposed to the other invites that they're getting, probably 25 to 50 a day.
And I would just say, and Amanda may want to chime in on this as well, on the rural side, the events tend to be similar, to be honest. I don't see a huge difference between the event types and the formats that I see out there. But I do think in rural areas, to the point that Margarita just made, there's often there are fewer events going on, and so the competition in the community in terms of what's being hosted on any given date may be a little bit different. But I think it just, the effectiveness and the success comes with work and knowing your community, knowing what they need, what types of events are really going to resonate with them. And I think whether it's rural or urban, once you get your hands around that, the location of your health center is less of a factor in being successful. Amanda, do you have anything to add?
No, the only thing that I would really add would just be the piece about starting a committee and encouraging staff to take part in that. What we have found is, when our staff come up with an idea and they do some of the legwork, and really what we just offer is guidance, we have a lot more buy-in. And the event, a lot of times, is actually more successful because the staff are excited about it and are really getting the word out. But in terms of, urban versus rural, it's really, as both you and Margarita said, it's really just, figuring out what works and what's going to grab the attention of the community.
Great. Any other questions, Elizabeth?
Yes. For health fairs and events like that, how do people engage the community? How do you get folks to come? How do you attract them and bring them in?
Wow. Okay. Well, I think Margarita may have some good thoughts on this, but I will go back to something that I said earlier, which is health centers work with such a long list of partners, and so I think the first thing to do is to contact partners and explain to them what it is you hope to achieve with the event, the timing, and so forth. But my experience has been that health fairs is one of the best ways to celebrate National Health Center Week because they tend to bring something, services and support to every type of patient. Sometimes health fairs are driven at a particular type of health, service, but when they are a wider scope, and so you have screenings for adults and pediatric patients and maybe your elderly patients, and you combine it with, for example, sort of a children's element so that, whole families can come. Lots of folks in the community have an interest in participating. I think working with the police department and the fire department, the radio stations, there's just really no limit to being successful with health fairs. I think it's a really wonderful format and can be very, very effective around National Health Center Week. But Margarita or Amanda, do you have anything to add?
I would just say one of the awesome things about the Health Center Week being in August, it's a really great time to tie it into themes like back to school. We do a lot of screenings for back to school and even sports physicals. So that's also a really good opportunity to get folks through the door, is tying it to a theme.
Agreed. Margarita, anything to add?
I echo everything that you said, and I would say, don't just limit the event to being about health. Bring in your community partners that do other things, and some of those things may not even be health related. For an example, when we do our Veterans Appreciation event, we have the Walmart Veterans Network here. We have homeless for the housing for the veterans. We have job opportunity partners who come in with job opportunities for the veterans. So think outside of the box, as Amanda said earlier, and just think about your partners are everyone that is serving the same demographics of people that you are serving or have a common interest in making sure that the health of the community is addressed. And so you don't just have to think about it being someone else who provides a health service. Think about the needs from the youngest people in the community to the oldest in the community, and coming up with creative resources that are there, and also creative games. We did an event where we were trying to, with seniors, and we had a bridge club that was of seniors, and they came in and played bridge, but in order for them to get their bridge seat, they had to go through this variety of health screenings in order for them to be eligible for the bridge tournament. So find things that are interesting to the demographics that you're trying to reach. For our pink carpet, roll out the pink carpet with Purple Butterflies is our breast cancer awareness event, and we actually partner with people to come in and do chair massages, facials, hand, natural manicures, etc. We have an artist that comes in and does drawing for women, and so we're rolling out the pink carpet for these women, but in the course of doing that, they meet our OBGYN staff. The mammogram unit is here, and we have them scheduled to have mammograms, et cetera, because I just don't think anybody is waking up in the morning and going, ooh, girl, I just can't wait to go over there and get my blood pressure taken.
So, no, I think you're right, Margarita, and you know, I'm looking at the time here. We're at 3:15, and we still have a lot of folks on the line, but I do want to be respectful of everybody's time, and I know we've got more questions, so we will follow up with other folks is in a direct way. And so if you have questions, feel free to add those to the chat box. We are going to make the slides and the recording available on the site, on the National Health Center Week site. It's www.healthcenterweek.org. You can see our contact information for our team. Alex Harris, who's our Manager of Grassroots Advocacy Special Pops, was not able to join us today, but she had a hand in creating a lot of the resources that you saw and that are available to you, and she's a wonderful resource as well. Big thanks to Elizabeth and Dorian for doing some heavy lifting to put together the webinar today and be a wonderful support to you all on the ground. Margarita and Amanda, thank you so much for speaking and presenting today and for all of your great work over the years around National Health Center Week. Just applaud everybody for taking part today. Thank you again to our national sponsors, and we're really excited about National Health Center Week 2016 and the 100,000 Advocates in 100 Days challenge, which officially kicks off today. And just thanks to everybody for helping us to make this year of celebration, this week of celebration, a success. Have a wonderful day, and we'll look forward to hearing from you in the future. Take care.